Namaskar दोस्तों. I am Purnima from Fertility Dost, and today we have Dr. Vaishali with us. I think Dr. Vaishali को किसी introduction की ज़रूरत नहीं है, but since it's an online platform, formal introduction is a must. Good evening, ma'am, and welcome to Fertility Dost.
Good evening, Purnima ji. Thank you. Thanks a lot for such a good introduction, I would say.
नहीं, I'll just introduce you because see, this is the very important live session we are doing over here because of topic. Because we have many members who are dealing with continuous failures in their IVF cycle, and this is the topic which are suggested by a few of our members. And so, viewers, let's start. And first of all, obviously, we need to introduce our guest, our doctor, Dr. Vaishali Sharma. So members from Delhi NCR, they are familiar with this name. I think उनको बताने की जरूरत नहीं है. But yes, since we are airing this session all over India and the members from our overseas groups also are here to watch this. So for you viewers, Dr. Vaishali Sharma is a national award winning laparoscopic surgeon. Yes, if you have any doubts regarding any laparoscopic issues, just write in comment box. Dr. Vaishali is the right person to answer your queries and don't hesitate. आप शुरू कर दीजिए अपने comments लिखने हम धीरे धीरे सबके जवाब देंगे. She recently won two national awards. One is National Hall of Fame and National Hall of Fame for Laparoscopic Surgeon of the Year 2019. तभी मैंने बोला don't hesitate, just pour in your comments. And she is also recognized as budding IVF specialist of the year at national level and with 15 years plus experience in this field of fertility. So, what are you waiting for? Just pour in your queries. And with the Dr. Vaishali, we are going to discuss lot many things. If you are into this journey, आपको पता होगा कि failures के साथ क्या-क्या reasons हो सकते हैं, क्या नहीं हो सकते. और अगर failures है, तो हम उसको कैसे ठीक कर सकते हैं. And for arranging this wonderful session, I would love to thank Shield Health Pharma. So over to you, Dr. Vaishali. Once again, welcome to our platform for this wonderful live session, and thank you so much for taking your time because I know आप कितने busy हैं और उसके बीच में आपने time निकाला. Thank you for that. And ma'am, to start with failed IVF cycles, what could be the causes? First of all, we really need to know about the causes.
Thank you, Purnima ji, and good evening, everybody. That was just really a very generous introduction, and it's my privilege to answer all your queries. I would love to answer whatever questions you have regarding laparoscopy or IVF. It's really my passion to find out the cause and then give them the solution. So that is why this topic is really close to my heart. Many of people are undergoing IVF cycles nowadays, and many of them are facing difficulties in conceiving in the first cycle. So we are getting many patients of multiple cycle failures. I can understand what is the emotional trauma they are undergoing. The financial burden is also there. So it is a multifaceted problem. I would say it's not just one emotional thing that they are not able to conceive. It is a multifaceted burden that the whole family has to face. So when a cycle fails, it is really a very hopeless situation for patients, and I would say as a doctor it is really very problematic thing and very disheartening situation for a doctor also. So let's discuss first the causes, what can be the reasons why a cycle fails, and what are the solutions that we have nowadays because of all the advancements in the technology. I would like to share the slides. I would like to show you, try to make you understand what's the physiology, how do the cycle works, and what all is there. So let us first start with the causes. What are the causes why a cycle is getting failed? See, as we all know, the factors which are determining the success rate of an IVF cycle is there are many. One is obviously the patient's profile, patient's age, body weight, lifestyle, professional work profile. All these things they are very important, and because all these things are in turn leading to good quality or bad quality of the eggs as well as sperms. So if we just say in a layman terms, I would say, uh, for a successful cycle we need good quality eggs, we need good quality sperms, and we need a receptive uterus. If we have just these three things, then I would say, I don't think there any cycle will fail if we have all these three things. But what happens majority of the times, any one of these things is lacking. We are trying our best to get good quality eggs, we are trying our best to select the best sperms out of the semen, whatever we are having, and also we are trying our best to transfer the embryo at the time when the uterus is receptive for that embryo. So at every step there can be a reason why that cycle can fail, and at every step there can be a reason which can make that cycle successful. So if we go one by one, step by step, we'll just see how can we improve the quality of the eggs and how important are the eggs. As we know, eggs are the basic major cell in which the sperm is being injected. So that is a major cell. If all of you have must have had biology in your 12th, you know that cell has a cytoplasm, it has a nucleus, it has so many things. So the egg of a woman is the major cell, which is just getting a genetic material from the sperm, but rest of the part of the cell is taken from the egg itself. So obviously, good quality egg is the most important thing that is needed to make a good quality embryo, which has the potency to develop further and to culminate into a successful or healthy baby after 9 months. So, what are the things which can make egg quality better, or how can we improve the quality of the eggs? As we know, age is the major determining factors. Nowadays, more and more people are delaying their marriage, they are delaying childbirth because of their career goals, because of their life and their professional targets. They can be anything. But I would like to say and convey this to younger generation that age is a very important parameter. I am not saying that you should hold on on to your career, or you should remove your you should cut down your targets or something. But yeah, do keep it in your mind. Age is very important, especially for females, for the equality. And 30 is, I would not say it is a good age to start to plan for a family. And if you are not able to see yourself in that zone at right this time, then I would say you have an option of egg freezing nowadays. It was not there earlier, but now we have that option. So instead of wasting your productive reproductive good quality eggs in that duration, just in the wait, while you're waiting for your that zone that you will marry, you will have kids, better to go for egg freezing. It's not not a big deal. It's many multinational companies are providing their employees with this option of egg freezing. They are financing also that thing. It's not that big thing or a bad thing, or any taboo is there. It's not like that. It's a very simple procedure. If you are not finding yourself in a zone to plan a pregnancy till 35, I would say don't wait further. Get your eggs frozen. At least you will have a backup at the end of the time. If you are not able to conceive when you marry after 35, you will at least have some eggs with you, which will definitely help you in having a genetic child of your own. So age is the most important factor, which I feel is nowadays causing majority of the failed cycles are because of the poor quality of the eggs, because related to age related decline in the quality of the eggs. Next, most important thing is the weight. Weight is really important. It's not just like that we need to look good, we need to have a zero figure. It's not like just like that. Weight is important for the good quality of the eggs also. If your body is in a good shape, or your body BMI is in the correct zone, if your body is fit, I would say every cell of your body is taking the energy from you. It is taking the blood supply, it is taking the oxygen supply. So if you see, if the overall total load is more, there are so if your weight is high, then definitely there is going to be higher insulin resistance. And all these things, they definitely cause a major problem in ovulation, in the quality of the egg. And when we try to make embryos, we find difficulty in making A grade embryos if we are getting eggs from a lady whose BMI is in the overweight or obese zone. So it is a good idea to keep your BMI in the correct zone. Do your exercise, do yoga, make changes in your diet, make increase your protein, decrease your carbohydrates. Whatever diet you is suiting you, just do that. Just try to keep your body BMI in the correct zone. Don't let yourself be in the overweight or the obese zone. Next is the lifestyle. I would say, yeah, majority of the couples which we are getting nowadays are from the IT background, I would say, because they have a lifestyle of such a sedentary lifestyle that they are just sitting in front of their laptop for 10 hours, 12 hours. They are not even getting up. Many of them, they are just lying in their beds with their laptops on their laps. I am always encouraging all my patients to first shift their laptop from their laps to their tables. Don't keep them on your
Right.
laps. And I would say, just take a break. If you're sitting for more than half an hour or 1 hour, just stand up, roam around, come back and sit. But at least give your body some movement, some this muscle movement is there, which definitely improves your BMR. If you're just sitting and sitting and sitting and just eating, lying down, sitting, then it is gradually decreasing your BMR. Your basal metabolic rate decreases so much that the body's insulin resistance again rises, and it again is not very good for the quality of the eggs. So these lifestyle and dietary habits, they are the major reasons why we are not getting good quality eggs, and in turn leading to many failed IVF cycles. Similarly, I would say this alcohol intake or smoking may be active or may be passive. It is very detrimental for the quality of the eggs. It's not just detrimental for the sperms. Earlier, we used to just ask the male partner that, okay, you are smoking, stop smoking for sperms, stop alcohol. I would say it is equally damaging for the eggs also. So cut down on your number of smokes and cut down on your drinks. I would say it is obviously much better if you can completely abstain from smoking and drinking if you are planning for a pregnancy or IVF cycle, because these, they are basically they causes oxidative stress in the body. So all the cells of our body are under oxidative stress if you are smoking or drinking. Otherwise, so what happens, the eggs, they are facing this oxidative stress even much more. Though you are getting normal cycles, though you are getting ovulation regularly, but the quality of the egg will definitely fall. I have seen many patients who undergo IVF cycle, first IVF cycle, they are just undergoing, okay, okay, it will happen. My many colleagues have undergone IVF, they conceive in the first cycle, and they really don't care about this their dietary habits of this smoking. If though they may do one thing, they will stop smoking themselves, but their partner may be smoking, somebody else, the colleague in your office may be smoking nearby you. That is called as passive smoking, and that is also going to definitely cause a negative effect on the quality of your eggs. So these things are really, they play a major role in the potency of the eggs to form a good quality embryo. Try to cut down from your life, try to cut down these habits, and also try to have a regular exercise schedule. Even if you are doing 15 to 20 minutes of exercise daily, 5 days a week, even that is also enough. That thing will stimulate your body to produce, I would say, endorphins or those hormones which are actually good for your gametes growth or the potency of your gametes. So exercise, yoga, meditation, all these things, they really have a very a good effect on the success rate of a IVF cycle. So, if you are going for a next IVF cycle, try to make these changes in your life and then go ahead with another cycle. So, these we have already talked about these things. These are the age-related decline in the egg quality. The gonadotoxins are alcohol, smoking. Obviously, we have already also the this is how we usually check about. We can come to know about the quality of the eggs in the blood tests or ultrasounds. So Now there are some medicines also which will help, which definitely helps us in improving the quality of the eggs, and in turn it helps us in improving the success rate of the IVF cycle. These molecules are really very, they have been proven to be successful and beneficial in many studies. So we have many natural resources also of all these multivitamins. We also have their medicine in the medicine form also. So the if you look at the picture, these are eggs basically, and if you look at them, these are the quality of the eggs which are being shown. This first one, if you will see the which one is available, it the eggs are usually very clear. They are actually completely round. So the first picture is of a very good quality egg. But if as we go move downwards and we see the further, these are bad quality eggs, and these are actually we get them. Patient doesn't understand what is the difference. Patient, they just undergo an IVF cycle, and then they say, okay, my friend's IVF is conceived in the first cycle, but I'm not able to conceive. So we try to provide them the pictures also. Whenever I'm doing an IVF cycle, we are providing them with the pictures of their gametes, the pictures of their embryos, so that at least they should know, they can compare what is the difference, why the embryos are not A grade or B grade or C grade. Some people, they are getting A grade embryos, and they definitely have a good success rate. I myself took out the success rate analysis of our cycles that we did, and I'll tell you, normally, as we say, on an average the success rate of an IVF cycle is 40%. Whole all over world it has been documented as 40%, maximum of 50%. But I'm telling you, when we took out the data, we saw if we are able to make a grade A embryo of day 5, that is called as blastocyst. So all the patients in which we could have a grade A day 5 blastocyst, the success rate of such cycles came out to be as almost 80 to 90%. So this is the importance of a grade A embryo. What is happening everywhere, everybody is just taking out the IVF cycle success rate on the basis of, okay, this much, this number of cycles were done, and this many people they conceived, this many people they delivered a baby. But when we took out the data, okay, when we had a grade A embryo of blastocyst day 5, then the success rate was actually 80 to 90%. So this depends upon this quality of the eggs which are being shown here. We can say, from if we move from A till H, this is a deteriorating quality of the eggs. Some are differently shaped, some have different numbers of nuclei, some have different number of intra cytoplasmic the organelles that we see. So this is not good. This A grade, this egg which is shown in this A box labeled as A, this is the best egg that we have, and this can be achieved only if you follow all the dietary changes, lifestyle changes, and if you can add these multivitamins through your diet or through multivitamins, whatever. But these have been proven to improve the quality of the eggs. If we discuss them one by one, melatonin is one molecule which is really important. Vitamin D is also important for improving the quality of the egg. These are the, actual studies where they have found out that these molecules really improve the quality of the egg, and then they improve the quality of the embryo. This is a picture from our lab. This is we are doing ICSI. These are again the eggs which are visible, and we are just injecting sperms in these eggs. So obviously you get such a good smile when you get a good quality egg. And we
Right.
become really sad when we get very bad quality eggs. So uh, similarly, when as we were talking about females, it is equally important for males. We need good quality sperms to make good quality eggs and embryos using those eggs and sperms. So, as we already know, semen parameters, many times, many couples, they get their semen analysis done, then they are just thinking, okay, what is the report? Is it bad? Is it good? It's not just like that. There are so many parameters are there that we have to look in that semen analysis report. There is volume, there is count of the sperms, the motility of the sperms, the morphology of the sperms. Morphology means how are they looking. If we look at them under the microscope, how are they looking? Are they symmetrical? And do they have the normal structure like the head, the tail, or they are abnormal? So that thing is called morphology. Vitality is how many of them are live actually. Many of them can be dead, though the counts can be good, but none of them may be alive, or all of them may be dead also. So these are the things that we actually look in the semen analysis. Similarly, we look at the pus cells. Many a times, semen parameters, everything is good, but there is some infection, and at that time, the pus cells are very high in that semen report. So these things, once treated just with antibiotics, can give you positive results in a very short period of time. Many a times, the only concern is just these pus cells. Everything is perfect, only pus cells are there, and those that infection can make those sperms not suitable for fertilization. So that may be the only reason why pregnancy is not occurring. Then this DFI is basically DNA fragmentation index. This is a parameter which tells us that how is the genetic potential of that sperm. Many a times the sperms may be there, the counts may be there, everything is perfect. But when we are trying to inject it in the egg, and when we are trying to make good quality embryos, we are not able to get embryos. And the reason behind that is this high DFI. High DFI is, we have to do a separate test for this DFI, and these are the normal parameters that I was talking to you about. Normally, the volume should be more than 1.5 ml. Sperm count should be at least more than 15 millions. Total motility should be more than 40, and out of this progressive motility should be more than 32% of the sperms, and vitality, that means those who are, which are live sperms, those should be more than 58%. This morphology I was talking to you about, it should be more than 4%. That means out of 100, if only 4 sperms are also normal looking, then also it is good. But the problem arises when it is less than 4. Many a times, if many a times you will see that in the your sperm semen analysis report, morphology is not even mentioned.
Right.
Many low, I would say small labs, they are not even mentioning the morphology. It is such an important parameter, and because it is possible that all the sperms are abnormal, whatever they are moving, they are live, they are counts is good, but when we look under the microscope, they are not looking as normal sperms. All of them also can be abnormal. In that scenario, pregnancy is not going to take place, whatever you do. So this, that is why I always ask my patients to get a semen analysis done from a very good lab. At least they should have a good microscope, because under which they will be looking at. If you have a very light microscope or not a very good magnification microscope, you will not be able to tell the morphology. So that is also one of the good parameters. This leukocyte count is just the pus cells. So, if this is what I was talking to you about, DNA fragmentation, this is a problem in, I would say, in the genetic material of the sperm. It is not capable of fertilizing an egg so that a good quality embryo is formed. When DFI is high, we ask the person to do a DFI when we are having multiple IVF failures, as I already told you. So in that scenario, we ask them to get a semen testing done for DFI, and if we find that there is serious severe DNA fragmentation is there, we have to treat them with very high, with good quality antioxidants for at least 3 months, and these molecules, they have been proven to improve the quality of the sperms and reduce their DFI. Once we treat them with those medicines for 3 months, and then we try to do the fertilization, we get good quality embryos. So these are really helpful. This is a test which also is not usually advised and not done. If we go to periphery, all the IVF centers, I don't think anybody of them are there doing. They are just doing IVF cycles. One patient came to me from, I don't know from where, northern India only. They underwent 9 cycles of IVF. I don't know, and they just didn't undergo any testing. Why is it failing again and again? You need to find out the reason. They are just changing their labs in the periphery. I think it was Punjab or Haryana. I don't remember the exact. And they are just changing the labs and they are just undergoing IVF cycle. They are not finding out what is the reason. Why is it failing? So if I'm when my one cycle fails, then only I ask them to get all these tests done, because when I have done a cycle, I know I have taken all the things that has to be done. And if even then if it is failing, then we do all the tests for the female partner as well as a male partner, just to see why did it fail actually. And I'm telling you, many a times we find a reason, and when we correct that reason in the next cycle, we get a pregnancy positive result in the immediate next cycle. So you should know first what are the causes, then you should know how to treat it. These are the medicines, these are the molecules basically which we use to improve the quality of the semen and to improve the DNA fragmentation that we were talking about, to improve the counts, also to improve the motility. So all these molecules have been proven of good benefit in all the studies. It's not just like that everybody has just written these, it's not like that. Many studies have been conducted when these molecules were used, and it was found that they really make good improvements in the semen parameters when taken for 3 months or more. Why I'm saying 3 months again and again is because the life cycle of sperms which are formed in a male body, it is 3 months. That is the total time which is taken for one sperm to form is 3 months. So if you're taking one molecule today, the deficiency which is being taken care of today, the sperm result will which it will come after 3 months. It's not like that you have taken one multivitamin today and the result will come the next day. It's not like that, because sperm itself takes 3 months to form in your body. So it is always advisable to take all these multivitamins and to make all the changes in your lifestyle and all dietary changes at least for 3 months to see any result. It is good if you can take them for 4 months also, you will definitely have a very good result. But you cannot expect such a dramatic result in just a few weeks or 1 month or so. So take all these medicines, and I feel that you will definitely have a good result. So now till this time we were talking about sperms and the eggs. So if we say these are just like seeds, when a farmer is sowing, they need good seeds, but they also need good soil. If the soil is
Correct.
not fertile, we are not going to have good plantation. That is the same scenario with the uterus. Even though we have good eggs, we have good sperms, and we are able to make good quality embryos, but if the uterus is not receptive and the internal lining of the uterus, that is called as endometrial lining, that is not receptive, that embryo is not going to implant. That process is called as implantation, and the embryo will not implant and embryo will not grow. You will not have a positive pregnancy result. So, to know if your uterus or the lining is receptive or not, there are many things, many tests that we do usually. One is the ultrasound, that is always done. We are doing it in all the patients. As you can see a picture here, it is a very good picture where a uterus is visible, the lining is visible. In the middle, you can see one more line, and this pattern of line is called as triple line. Triple why? Because you can see a whitish line outside, again you can see a blackish zone inside, and again there is one whitish zone in the center. So this pattern is called as triple line, and it is really the most desirable pattern which we want whenever we are transferring an embryo. And many times it is not there. We try our best to give all the molecules, all the hormones to make the uterus this, so that this kind of a lining is formed. But if you have this kind of a lining, I would say 90% or 99% your chances of having a good pregnancy, a positive pregnancy with a grade A day 5 blastocyst embryo is almost 90%. The only thing which is there is these are the parameters which we look over here. First is the endometrial thickness. Thickness is this thickness part. Means the pattern may be good, but the thickness may not be very thick. That means if we take the measurement of this thickness, it is the lining where basically the embryo is getting embedded, and then the implantation is occurring. So if this thickness is not enough, I would say it should be at least more than 8 millimeter. We will have a chart further which will show us what are the various thicknesses and what are the chances of pregnancies at that thickness. So if it is more than 7 mm or 8 mm, then it is really good, and the chances of pregnancy are really good. So these things we usually measure on ultrasound. It is not a very big deal. It is easily we can measure them. The next thing is the pattern that I already told you, triple line pattern. Third thing is the blood flow. Definitely, you need a good blood flow. And many times, if we are not able to find good blood flow, we are giving blood thinners also to the patients. We are giving ecosprin. You must, the people who have had failed IVF cycles, they know you must have taken ecosprin. You must have taken heparin injections, and vaginal. There is this sildenafil is also given to improve the blood supply. So many things are there which we do to improve the blood flow. Then there are these calcifications. We really hope that there should not be any calcification, because you can just consider them like the stones or pebbles in the soil which will not let anything to grow. You need just fertile good soil. So calcifications are whitish dots which can be there due to infections in the past, or which can be due to multiple DNCs which were done in the past for any reason. So these calcifications can be there, but these are not good sign. This is not a good sign to see calcifications over there. Then there is this ERA. ERA is a test which is usually done in the people who have multiple failed cycles. ERA tells us the receptivity of the uterus. And that is what I was telling you about. Whenever we have a negative IVF cycle, if we have done it and the result has not come positive in the first go itself, then we do a lot many tests. This is one of them, because if you have transferred a good quality embryo and it has not implanted, then that means there is something wrong with the uterine receptivity. The uterus may not be ready for that embryo at that time, because see, all the people, they are different. Their uterus is different, their body's physiology is different. Whenever we are transferring an embryo, we are giving them progesterone exposure of 5 days if we are transferring an embryo of 5 days. So what does it mean is, we are giving progesterone exposure to uterus uh, for 5 days. That means the uterus is now ready to accept an embryo of day 5. But what happens, many a times somebody's uterus may not be that fast. I usually try to explain this in a layman term in this way only. Somebody's uterus may be slow, somebody's uterus may be faster. So what happens? We are giving them progesterone for 5 days, but the uterus, if it is faster, it must have been ready a day before yesterday also. So that means we have overcome the window of implantation. So this test, it tells us what is the actual window of implantation of the uterus. Is your uterus working at a normal speed, or is it working faster, or is it a bit slower? If it is slower, if this test, it tells us that no, it's working slowly, then what do? We give you progesterone for 6 days, so that give your uterus good time for 6 days, and then we transfer an embryo of day 5. So that means we have given it enough time to make those changes which were needed for the implantation of the day 5 embryo. But if this test tells us that your uterus is slightly faster, then in that case we give you progesterone only for 4 days, and then we transfer that embryo of day 5 on fourth day of progesterone only. So this way we are able to find out when was your uterus ready for implantation. This test has given us very good results to us. All our cycles, which I would say almost 90% of the cycles, which with we were not having good positive result in the first go itself, we did error and we found out, yeah, there was some changes in the uterus. We made those changes in the next cycle, and we got a positive result in immediate next cycle. And many a times,
So,
yeah.
Dr. Vishali, one query. We were just discussing about this ERA test. See, in this cycle, I am planning my ERA. So, when would be the transfer? In the next cycle only?
Yes, next cycle.
Okay. Thank you.
This cycle, if we are doing era, we are
Mm-hmm.
preparing your body almost as we are preparing you for embryo transfer, but we are calling you to the center, but instead of putting in the embryo, we are taking out the cells out from the uterus. Just
Okay.
thinking, if we would have put that embryo at that time, what would have been the scenario inside? So we prepare everything the way it is for the embryo transfer, but we don't do embryo transfer. We just take the cells out, then we send it to the lab. It itself takes 10 to 15 days for the results. So that cycle is just done, and in the immediate next cycle, we again repeat that treatment what we did in the last cycle, and then we make those changes according to the report. Then we do the embryo transfer in the next cycle.
Okay.
Only thing with ERA is that it is really an expensive test. Otherwise, we would have done it for everybody before planning embryo transfer. It is actually
Right.
it costs around 60,000, so it is very expensive. So when
Right.
we
Right.
have very good lesser number of embryos and the patient doesn't have any problem in paying for this extra 60,000, we usually advise them कि okay, we have just two embryos of yours because of the age related or any reason, by due to any
Hmm.
reason, lesser number of eggs or whatever. We always tell them, if you, because we have such a lesser number of your embryos, if you want to go ahead with ERA first, you can do that. Only problem is it is expensive. It will cost you 60,000 extra add on to your IVF cycle. Otherwise, it is
एक
a very
और
good test.
अ,
Yeah.
मान लीजिए दैट वी आर डूइंग दिस एरा टेस्ट नेक्स्ट साइकिल में इज इट पॉसिबल कि हमारी वो विंडो का टाइम चेंज हो जाए इज इट पॉसिबल कि जो यूट्रस है उसकी ग्रोथ स्लो हो
Oh,
जाए
yeah,
या
it
फास्ट हो
is
जाए
possible. Yeah, it is possible
ओके
because physiologically your body is obviously not a robot. It will program, it is programmed like this. It may
राइट
change.
राइट राइट
But what I
ओके
have seen after so many cycles, I have found out that whenever there is some problem in the era, and whenever we are doing that changes in the cycle in the immediate next transfer, we got positive result in all of them. I'm telling you, all of them.
दैट्स ग्रेट
Yeah, so that is why if error tells us something, there was some shift, then
हम्म
it is actually beneficial, and it really gives us a good result in the next cycle.
Right, right. Because we are transferring the good embryo and we
Yeah,
have to obviously see the uterus part, right, right. So
yeah,
I
right.
think viewers, if you are having these failure issues and you are visiting your doctor in near future, in a day or so, maybe you are planning for the next cycle, then you can ask your doctor for this particular test. And we really hope that you get the positive result after this test.
Yeah.
Please, ma'am.
Yeah, so similarly, when we are discussing the uterine receptivity part, next is adenomyosis. Adenomyosis is also one of the reasons why the negative IVF cycle occurs. Many a times, it is overlooked. Many of the people, they just concentrate on the endometrial thickness. They don't actually look at the uterine part. But if adenomyosis is there, then it definitely is a negative thing for the embryo. It doesn't let implantation occur. So what we do for adenomyosis is there is an injection of GnRH depot. What does it do? It just shut down all the hormonal thing in your body. So what happens? Uh, Everything, you will not get your period. This is done once we have made your embryos. So we already have your embryos with us. Now what are we doing? We are making your uterus ready for implantation. Now we don't your eggs. We don't want your ovaries to function. We just want your uterus to be receptive. So at that time, if adenomyosis is visible there, what do? We give you injections. We shut down your cycle. There will not be any period for 2 months, 3 months, till the time we are getting a good picture of uterine muscle. And when it is there, then we make the lining, we get a beautiful lining, and then we do the transfer. So adenomyosis is also one thing which is responsible for multiple IVF failures. And when we take care of this thing just by few months of medicines, it gives us very good results.
And
Similarly,
Dr.
polyps.
Vishali,
Yeah.
what is the simpler term for adenomyosis?
Adenomyosis, I would say what happens. This endometriosis is very common. Everybody knows
Right.
about endometriosis. So this is actually endometriosis interna. Interna means the endometrial lining which was there, which was supposed to be till here, that is present in the uterine muscles. Endometriosis is when
Okay.
this endometrial cells are present somewhere outside uterus, maybe ovary,
Outside.
maybe
Right.
pelvis. When those endometrial cells are present in the uterine musculature, just beneath this endometrial lining, that is called as adenomyosis. So that thing, what does it cause? It again changes the receptivity of the endometrium, because that lining is growing inside the uterine musculature. So lining is obviously hazy, we never get this kind of picture, and their receptivity is also deranged. So when we shut
Okay.
down that cycle with the injections, the way we do in endometriosis also, it
Mhm.
resumes the normal musculature. We get normal endometrial lining. This is basically a type of endometriosis only, which is localized to uterine muscles.
Okay. So usually we see the term used as bulky uterus. So bulky uterus is equivalent to
No,
adenomyosis?
no, 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 no.
Or
Bulky is the
okay,
size.
it is.
It is just
Okay.
the
Right.
size. It can be
Okay.
bulky because of anything. It can be because of fibroid. For the
Mm-hmm.
many, it is bulky in all the multiparous females. A female who has had two, three kids, two, three pregnancies, the
Mm-hmm.
uterus can be bulky. It is just the
Okay.
size. In
Okay.
adenomyosis, there are few things which are visible in ultrasound. This lining, as you can appreciate it here, the white line, it is so clearly demarcated with this darker line outside. The darker part is the uterine muscles. This white line is
Okay.
the endometrial lining. In adenomyosis, this demarcation is lost. It becomes,
Okay.
everything becomes hazy.
Hazy.
Nothing
Right.
is
Right.
such a clear, it is not clearly visible. So that is adenomyosis, and it is mentioned. The people who know what is adenomyosis, when they are doing ultrasound, they mention it clearly that yeah, uterus is looking adenomyotic. It can be
Okay.
focal adenomyosis, it can be generalized adenomyosis. So whatever it is, we try to treat it before planning our embryo transfer. Similarly, polyps, this can be one reason. Many times, if it is missed, then it will not lead to implantation occur. This is again a small growth, I would say pimple kind of a thing in the uterine lining, very small
Right.
growth which is there in the uterine cavity, but it irritates. Obviously, it causes some irritation over here. It will increases the mobility of the endometrial lining. It will not let implantation or the pregnancy to stay. So polyps are, but the good thing is these are most easily treatable thing. If we are finding a polyp here, we can treat it nicely. It is done removed hysteroscopically, and we can do the transfer next cycle. If we find out that the cause of recurrent IVF failure is polyp, then it is the best thing that can be done because we can treat it very nicely, very easily. And it is a daycare procedure, no stitches, no scars, nothing. We just put in a small camera from here inside the uterus. We just remove it from its attachment and we just send it to the lab. So this is the best thing which can be treated, and it can be treated so easily because of the hysteroscope nowadays. So fibroids, again, that can be the reason why they are hampering the receptivity. For fibroids, we need to have a 3D ultrasound done to find out, are they coming in way of the embryo transfer, are they impinging on the cavity, are they pushing on the cavity, or so depending upon their size and their location, we need to decide, do we need to give injections or medicines to reduce their size, or do we need to do a surgery for their removal before going for embryo transfer. So we have to see depending upon the size and the location of the fibroids. This
Mm-hmm.
hydrosalpinx, if we say, it is the liquid which is filled in the tubes. If we say in a layman's term, if there is some collection in the tubes of the uterus, that is called as hydrosalpinx. Why is it problematic in IVF? Is that if that is communicating with the uterine cavity, tubes are obviously opening in the uterus,
Right.
so
Right. Right.
that opening is patent and there is collection over here. So what happens? This collection may be dribbling continuously in the cavity, and it may not let pregnancy to occur. So if there is any hydrosalpinx, then we plan for clipping of that hydrosalpinx, we call it. Basically, we are just obstructing or we are just removing that continuity to the uterus. We are cutting on that continuation where that thing is coming into the uterus. So as such, if a tube has a hydrocephalus, it can be removed also. But many a times females, women, they feel uh, very setback they have if we say to them that "Ki, we want to remove your tubes." Though hydrosalpinx means that tube is not working at all. It may
Right.
be patent, it may be open, it may be working. If you are putting in a fluid, it is going out. But hydrosalpinx means the inner cells of that tube have been destroyed. It may be because of any infection, it may be because of tuberculosis. Due to any reason, that thing has been destroyed. So, ideally, it should be removed. But many a times it is not possible whenever we ask somebody that we want to remove your tube, especially to a female who has not had a child till then it's not possible. So what we are doing, basically, we are just sorting it out. We are discontinuing their communication to the uterus, so at least it will not hamper in the IVF cycle or the pregnancy which is occurring through IVF. So these are the
One more thing, Dr. Vaishali, you just said ki you clip the tube. Is it possible to unclip it again?
yeah, it is possible.
Okay.
That
Because few days back we have one query. The lady was asking that my tubes are clipped. So she was like कि क्या मैं इसको unclip करवा सकती हूँ? So
Yeah, we can do that. That is called as recanalization. But again, I
okay,
would say the success rate of that recanalization is not very good. We used to do
okay,
recanalization earlier, especially it is
mm-hmm.
beneficial for those people who have undergone a tubal ligation as a contraceptive method. Many times
Okay,
mishaps occur. A couple may have had one or two children, but due to, and then they had undergone a surgery for the contraceptive, this thing, they have undergone a ligation, tubal ligation. But some mishap occurs, they lose their children due to some problems, some disease or anything. Then,
mm,
when they want to try again for a pregnancy, in that scenario, we go with that surgery of recanalization. There, it is more beneficial because in that
right,
scenario, they don't have any other reason of infertility. But when a patient who has infertility and they have undergone a clipping, that means there must be some reason why the pregnancy was not occurring. So
right,
even if we do remove the clipping, I don't think it will be beneficial. It is beneficial only for those people who had clipping for tubal ligation for contraception because they had
contraception. Right,
kids. Yeah, in that scenario, it is really successful. It if we are doing it laparoscopically, and it is good. Earlier we used to do it open surgery for tubal recanalization, but nowadays it can be done laparoscopically also. That is beneficial for such a couple.
okay,
Okay, so let us move ahead to the next slide. Yeah, this was the slide I was talking to you about. These are the endometrial thicknesses. There was this
okay.
study which was published, and it showed that the success rate number of pregnancies, as you can also see here, were maximum when the endometrial thickness was between 8 to 10 millimeter.
8 to 10,
The number
right,
of, yeah, number of pregnancies decreased when the thickness was lesser than 8, and number of pregnancies also decreased if the thickness was more than 10. So ideal thickness is 8 to 10 millimeter only, because if it becomes too thick, as we can see, if it is more than 14 mm, then also there is no point of going for embryo transfer, because that lining will not stay, will not hold till that time ki embryo will implant. It will fall off after some time. So this
okay,
thickness of
right,
8 to 10 millimeter is important. Majority of the time people are just concerned, okay, it is still thin, thin, thin. Majority of the time the thin endometrium is major problem. But I would say we should also keep it in mind that thickness should also not be more than 14 mm when we are planning an embryo transfer. Then also the success rate is also not good. So uterine
right,
thickness is one parameter that we usually see. Then this is the blood flow that we see, zone 1, zone 2, zone 3. We can see this is basically the blood flow present till the center of the lining. If it is there, it is definitely gives us good results. Majority of the pregnancies are occurring in that zone only. So this is the picture of blood flow. This is how we look at the blood flow. If it is present just till up till the base, then we call it it is not that good. But if this blood flow we can see till the center also, then that
Hmm.
means the whole of lining is well perfused, blood is available till the whole thickness, and that means embryo will have good supply of blood and oxygen and all the nutrients, and the implantation success rate will be more in this scenario when blood supply of this lining is good. There are many medicines that we use for improving the blood supply, as we already discussed. This was the error test that we were discussing. This is how
Right.
we get the result. It is mentioned as receptive. That means what we did in the last cycle, we have to repeat the same thing because it is working in the same fashion. There is nothing derangement, nothing. Neither it is too early nor it is too late. But if we are getting it as pre-receptive, then we are making this kind of a change, as I already told you. That means the uterus has already, it is pre-receptive, that we need to wait for some more time
Wait.
for the uterus. That means this uterus is slow. If it is post-receptive means now it is too late. That means it is very fast. We had to do the transfer yesterday. That means on the fourth day of progesterone itself. So this is the way we make changes, and this is how we get the report. So this is the era test that we already talked about. This is what I was talking to you about, the quality of the embryos. It actually depends upon the quality of the eggs and the sperms, but also on the lab quality and the culture of the lab. If the lab is doesn't have a sterile culture, or if it is infected, or if it is not that good, then the embryos may not grow. So that is why always choose your IVF lab very after a good decision, after looking at or having a look at their what are the particulars of their lab. I have seen labs. You won't believe. I have seen labs in the peripheries where they have just kept incubators in one room, nothing else. They are just doing IVF like that. It is a normal room, and there is
Hmm.
no filter, there is no temperature monitoring, no wall shielding or anything, no culture, nothing. They have just kept incubators, and they are doing IVF cycles there. So in that scenario, it depends upon, okay, how lucky you are to have a positive pregnancy.
Right.
So whenever you are planning an IVF cycle, always look at the lab. It should be good. It should, because the culture depends upon the sterility of the lab and the what filters are there, what uh, mm, we have there one thing called embryoscope. That is a different kind of incubator where we put in the embryos for 5 days and then we don't touch it. मीन्स देयर आर अदर इंक्यूबेटर्स. आप इंक्यूबेटर समझ लो, फ्रिज टाइप की सी चीज होती
Fridge. Right.
है ना? It is a
Hmm.
kind of a fridge only. So we are putting in the embryos, but you yourself can imagine, if you have to look at their growth, you are just opening it, you are taking it out, looking under the microscope, then keeping it back. You yourself must be knowing, घर में मम्मी बोलती नहीं थी फ्रिज बार बार मत खोलो खराब हो
Not
जाएगा.
cool.
So
Right.
obviously this is that thing only, that those incubators, the person has to be really trained to operate them. And the thing is
Hmm.
that if they have embryoscope as we have in our lab, that embryoscope allows us to have a look at the embryos from outside, because they have inbuilt cameras over there. We don't open it and we don't take out and we don't look at their, okay, what is, how is it growing, or how much, which stage have they reached. There are cameras there. You just have you there are screens in the front of the panel, and you can yourself see, okay, how are they developing inside, so that the environment around those embryos doesn't change. That is why
Right.
the quality of the embryo will depend upon the systems what we have in the lab. Laboratory is also one important thing. It's not just the persons who are doing, but labs also. I am doing IVF at 3 labs, and I have chosen those 3 labs after so many years of searching for good lab. I've seen so many bad labs that now I've stopped doing IVF cycles at those labs. I'm attached to three hospitals, and all of them, they have a very good quality, state of the art laboratories, which where we are getting good quality embryos. So the that is very important. Then comes various techniques which we use to make good quality embryos like ICSI, IMSI, day 3 or day 5. We already know many of the people now, those who have failed IVF cycle, they know day 5 embryos are obviously better. Blastocyst implantation chances are much more than day 3 embryos. Again, fresh and frozen cycle transfers, I would say frozen transfers are obviously better. We are doing almost 99% cycles are frozen, which we are doing. And
Frozen, right.
that is why I told you ki if we have a grade A embryo of day 5 blastocyst and we are transferring it, we do it in frozen transfer only. We are not doing fresh transfers. So in that scenario, success rate of that cycle is almost 80% to 90%. So it is because of these changes only. When we have made some protocols, okay, we are doing blastocyst only, we are doing frozen transfers only, and we are taking care of these laboratory parameters. So the success rate really improves a lot. Then there are many morphological classifications. So there is this picture of grade 5AA blastocyst. This is a very good blastocyst, beautiful blastocyst. Otherwise, it is really very disheartening to see a B grade, C grade blastocyst. You really don't like to see them. It is really very disheartening because we already know it is very difficult to get a positive result with C grade embryos. But I'm telling you, recently I had one patient. She had only three embryos. There was poor egg quality, poor sperms, but she was they that was their first cycle. So they were like, okay, try with our gametes. We tried. We could get only three embryos. That too for day 3 only. We talked to them. We asked them, ki, okay, do you want to go ahead? There is a chance that if we go till day 5, there is a possibility that these can degenerate also. It is up to
Right.
you. Do you want to go for a blastocyst or do you want us to just do the transfer of day 3 only? So they were like, okay, we don't know, we have just these three embryos. So okay, don't go till day 5, we will just transfer all these three. So we said okay. We did a frozen transfer with them, and it was not A grade embryos, those were B and I think C. So I was not very hopeful. I told them also, okay, we are trying our best, and I'm telling you, it is B grade and C grade embryos. The chances of pregnancy is not that good, and it is just the day 3 embryos. But they were like, okay, this is our last shot. Let us give it our last shot. Otherwise, they will have to go for donor gametes only. So that was their first cycle only. And we did that, and you won't believe, out of those three, one implanted. We got a positive result with a C grade embryo. And then also I was a bit worried. Oh no, I don't know, miscarriage may happen. I don't know if will it continue till 9 months or not. But luckily it continued. Then I did their delivery also. They were like, we want
Wow.
delivery from you, and they got a very beautiful son. So now they are really happy. Okay, my upper cycle got successful in one go
Right.
itself, and that too just with three embryos.
Day
So that
3
was,
embryos, right.
yeah, just there three embryos, that too of day 3, and with C grade. I was really not hopeful. I told them also, but they were like, just do your best, whatever is possible, and then let us see. So it is, God is really kind, and it's really good to see good results in such difficult conditions. Then. So
Right.
similarly, if we discuss PGS and PGD, it gives us, this helps us in selecting when we have a good number of embryos, then we can definitely go ahead with PGS and we can select good embryos which are having no genetic problem there, because there are some chances of aneuploidies in embryos, and PGS can tell us which embryos they have normal genetic material. So this can be done. Again, the problem here is it is very costly. It will again cost you 60,000 approx for four embryos to get PGS done. Otherwise, it is advisable to go for PGS for all your embryos. If you have good number of embryos, you can definitely do PGS and select only those which have normal genetic material. But again, it is a financially it is a limiting thing. But if we are able to do PGS, it again improves the success rate of cycle really really well. Then this is laser assisted hatching. It also helps in some of the people where there is failure, multiple failures are there. So many a times it helps in having good quality embryos. So this was a okay. So if we see, this is again a study which compared ICSI with IMSI. So many of these things they have proven to have good results. And these we are doing especially in the people who have multiple IVF failures. These are not meant for people who are coming for the first IVF cycle. These are for those who have severe problem with the either with the gametes or with the multiple failures, which those who are coming to us with those cycles. So this pixie or match, this again is very important for improving success rates of IVF cycles with severe male factor infertility. They help us in selecting, I would say, the best sperm for fertilization. So these techniques are really helpful in those cases where there is severe problem with the sperms or there are multiple IVF failures, PGS, PGD, as we already discussed with you. So embryoscope that I was telling you, it gives us an undisturbed, stable environment. This is this kind of a picture, though it is a bit blurred, but it is an incubator with a panel which has inbuilt camera system, which gives us this kind of picture on our desktop, and we can see how they are growing inside. Okay, this is again an article on my website only for the success rate of an IVF cycle. So whatever I have told you is that is the only thing that is written there. These were the results of some of our patients that we took. So that is what I wanted to show you. So many positives and only few negatives. And these also, when we advised them to go for ERA, we found out that there was some derangement. We corrected that, and we got a positive result for them also. So this is what I'm telling you. If IVF cycle is done nicely, and if it is not giving you positive result, even then definitely there we can find out at least a reason by using these technologies and try to correct it. So nowadays, I would say it's not like that. In earlier times, it was like, okay, IVF has a very low success rate. It is hardly 40% positive or 50. It's not like that anymore.
Right.
Nowadays, we have very good technologies, very good lab parameters are there, lab structure. Everything has developed to such an extent that I would say, if we are getting good gametes from you, that will depend upon your lifestyle. If you are able to give us good
Right.
gametes, we will be able to make good embryos. So, and in that scenario, we can have really positive IVF cycle in the one first go itself. So
Right.
I
So
would just want to
start
ask.
preparing your body. So you
Yeah, I always tell this to my all the patients who are not even coming to me for IVF, to all the young girls who are coming to me for some other reasons, maybe. I always tell them, just make sure that whatever diet you are taking, whatever lifestyle you are following, it has an impact on your eggs. So don't
right.
take it so lightly. Don't take it so lightly. Nowadays, the age for everything has been pushed by career or by whatever this thing is there. But yeah, you have the options. Don't lie in ignorance. Don't just sit there and think, okay, we'll think and we'll see. It's not like that. Please come for at least a counseling so that you know what are your options.
Right. Right. और वो एटीट्यूड आई थिंक वी नीड टू चेंज कि हो जाएगा टाइम है कर लेंगे
No,
that is
yeah,
wrong. Right.
right.
So, Dr. Vishali, we'll take a quick queries. We have few.
Yeah.
The lady is asking for the reason for IUI failure. Follicle size was 20 into 24 mm, endo lining 10 mm, and doctor said sperm quality and mortality is also good. Age 32. What could be the reason? Already two cycles done. So, what should be the next plan of action? Whether she should go for third IUI or you would suggest her to directly go for IVF.
See, it's looking like her tubes must be functional. That is why she is undergoing IUI cycles, and
Right,
everything is
right,
looking good. Follicle size is also looking fine to me. And I hope they must have checked that the ovulation occurred on the day of IUI, because sometimes this thing is also seen that follicle may be there, but when we give them
right.
trigger, some of the people they don't have ovulation. I have had such kind of
Hmm.
patients earlier. So what
Okay,
happened? That follicle, it just starts keeps on increasing in size, and there is no ovulation at all. So I
okay,
hope whenever they underwent the IUI cycle, the that thing must have been checked there, that the ovulation had occurred by that time. If they had not checked it, they can definitely go for IUI and do this thing, this change. They can have, we are giving a dual trigger sometimes also to improve the success rate, which ensures that yeah, ovulation must have had occurred. And if everything was done nicely and ovulation also had occurred, everything was good, even then they have not conceived by 2 cycles of IUI, I would say it is looking like again an unexplained infertility. Then that means in unexplained infertility, what is the thing that everything is looking grossly normal. Okay, but when we look at these things under microscope, then we find out what are the reasons. Many a times, what is there? The follicle may be there, but when we take out the eggs out of that follicle of 20 maybe, there is no egg. I have seen such
Right,
cases.
right,
Follicle is just a place where egg is just thought to be. Okay, it should be there. But it is a egg is a microscopic thing. It is visible only when we take it out when we are doing an IVF cycle. So many a
right,
times follicles can be there, but eggs are not there. That is called empty follicle syndrome. Other thing is egg may be there, but when the egg is taken out, then we find out okay the quality is not that good, or there can be a reason there can be problem with the fertilization. When we try to take eggs and when we leave them for simple fertilization with the sperms, they don't fertilize, so we have to do ICSI. So all these unexplained infertility cases, when we do IVF cycle, at that time we find out what is the reason. Unexplained infertility is a very broad group
right,
which
right.
basically includes all those causes which are actually microscopic. So I think if she should just find out if the ovulation was documented in the life cycle, then she should go ahead with the IVF or maybe maximum one IUI. No point of going for more than three IUIs.
Right, right. And obviously, by doing n number of IUI cycles, we are losing the most important part of our age.
Yeah.
So that
Yeah.
is also important.
Yes.
So I think there are many, many questions. I'm so sorry. So so what we were trying to say is कि आपके पास सब कुछ है, आपके पास अच्छे IVF डॉक्टर्स हैं, आपके पास अच्छे लैब्स हैं, और ज़रूरत है कि you need to figure it out. सबसे पहली important चीज, as Dr. Vaishali just mentioned, work on your gametes with healthy lifestyles, exercise, food habits. सब कुछ हमें पता है, पर शायद हम सोचते हैं हो जाएगा या हम कर लेंगे. That is more important.
Yeah. Right.
So we answered most of the queries, and if you think that आपका कुछ queries रह गया है and we are unable to answer that, please let us know. Please connect us on our official number. And Dr. Vaishali is here in Delhi. Someone is asking here. So Dr. Vaishali is here in Delhi. If you want to meet her, let us know. We'll arrange for your uh, appointment with her. And thank you, Dr. Vaishali. Thank you so much. It was, I could say that more than 1 hour we are here on the live
Yeah.
session. But
Yeah. I was also looking at the time right. Okay, how long we have taken.
नहीं, बट आई थिंक इतनी देर के बाद हमें इसमें से एक भी क्वेश्चन लेने की जरूरत नहीं है, बिकॉज वट एवर पीपल आर आस्किंग हमने पूरा
Yeah.
डिस्कस कर लिया है. इट वॉज
Right.
रियली आई वुड से कि इनसाइट था. वी नो छोटे छोटे डिटेल्स हमें पता होते हैं, बट ऑन स्क्रीन उनको देखना और किसी डॉक्टर के थ्रू उनको समझना, दे गिव अस
Yes.
टोटली डिफरेंट आउटलुक. So I
Right.
would say that it was like very nice session, though it was a lengthy session, but it cleared
Yeah.
n number of doubts, n number of doubts. And thank you, Dr. Vaishali, for giving us more than 1 hour and explaining each and everything in such a nice manner. Thank you so
Thank you.
much.
Thanks, Purnima ji. Actually, this topic is such close to my heart now. I actually lose track of time myself many times while talking to
नहीं नहीं
patients
हम
also. My coordinator usually comes from out and just wave me, okay, ma'am, there are more patients out there. It's not just this patient. So I really lose track of time, but I am really privileged that I am really able to solve some of your queries, and I'm able to tell you some points where you can actually work upon and make your IVF cycle successful, so that it
Right,
is
right,
good for you as well as for your doctor, because it really disheartens us also a lot.
right. And we really are hoping for another session with you. So hopefully
Definitely,
we'll get your time soon.
definitely, definitely. Thank you.
Thank you, Dr.
Thank you,
Vaishali.
Purnima ji.
Thank you. Thank you. Bye bye.
Thank you. Bye.